so I have to deal with this hair right now. But it's work o'clock. Let's see if anybody's online. It's a Saturday morning, and Nurse Miss Mary is at work. Hello everyone, how are we doing? And trust we're doing great. Just trying to see who's online. Hello everyone. How are we all doing? Hope we are doing fine. Fatimata Janessa, hi from Sierra Leone. How are you doing, Fatimata? Trust you're doing great. This is saying hello to you. Waiting for others to join. Dotun Suleiman, what are you teaching us today? I'm teaching you what you asked me. That's what I'm going to be doing today. So whatsoever question you ask me, that's what I'm going to be doing today. That's what I'm going to be teaching you. So I'm here to clarify your doubt. I'm here to answer your questions. Yeah. Chinyere John Ike, you want to talk to me? You can book an appointment with me online. Just send me a message on Instagram, then I'll send you the link to book an appointment. Flano Soka, hi from Kenya. Hello, how are you doing? Trust you're doing great. There's no good lighting here, so everywhere's kind of dark. So pardon me. When I want to come online, I don't actually look at the lighting. I don't actually look at where I am. I just come online when I want to come online. Don't mind me. So I try as much as possible to be getting a lot of light when I come online. So everywhere is pretty dark. So I'm just trying to hope you can, at least you can see my face. You can see a shadow of my face. That is what matters. Flannel is from Kenyan. How are you doing, Flannel? How are you doing? Trust you're doing great. Feel free to drop any question. Okay, you don't have an IG. Since you don't have an IG, I'm going to type the number which anybody can reach me with on the comment section. Just give me some time. I'm going to type the number. I'm going to type the number on the comment section. Just give me some time, please. I'll type a number that you can see me with on the comment section, then it will be much better. Let's see what I can do. Let me use my other YouTube account to actually... I'm going to type my number. For those that want to talk to me, for those that want to speak with me personally, I'm going to be typing the number on the comment section with my other accounts. So when you see it, I'll let you know. I'll type it now. Okay. So I'm going to be typing it. It's +234 because it's a Nigerian number that I use on WhatsApp. +234 8123 23719105. So I think you get a number on the comment section now. Let's see if it's going to pop up. Just give it some time. I've typed it in the comment section. I don't know why it's taking ages to come. It's not coming. let's see if I can chat. I don't know why the number is taking age. It's not appearing. Okay, let me do 0812371. Let's see. I don't know why the number is not popping. Maybe it's like a YouTube policy thing. My number is not popping. I typed it and sent on this my phone, but it's not coming up here. So I don't know why. So for those that are asking, I'm going to be calling the number. It's +234 is a Nigerian number that I use for my WhatsApp. +234 8123 719105. So that's the number. So you can contact me on WhatsApp. I might not be able to reply soon, but definitely I'll try my possible best to reply as soon as possible. Okay, I'm going to be typing it little by little. So +234 8123 then 7191 then 05. So okay, that's the number. You can see my name, Osumeka Messi Mary. So it's +234 8123 719105. So it's on the screen, it's on the comment section. So you can write the number down, chat me up, then we'll send you the link to book an appointment. So you might not get a response immediately, but definitely you get response within 72 hours. That's within 3 days. You're going to get a response to book an appointment, and we can have a conversation. For those that have been telling me they want to speak with me, they want to have a private time with me, a private conversation to be specific with me. So I'm going to be dropping, I've dropped the number already, so you can save up the number now. I'll advise you to save up the number now and send me a message on my WhatsApp. So if I get the message on WhatsApp, I'll just send you the link to book an appointment. Since I'm here, this is my other line, on my Nigeria line. So I'll just send you a message now. Since if you want to book an appointment, send me a message now. As I'm talking to you now, send me a message now on my DM so I can send you the link as soon as possible. Okay? Because once I get out of here, holding this phone is going to be difficult. Once I get out from here, replying messages is going to take 72 hours because I have a lot of messages on this phone I have not replied. But if I see it pops up now, definitely I'm going to reply now. So if you want to book an appointment with me, send me a message now. I'll send you the link before the day. I'll send you a link today, then we'll fix a time for you to book an appointment, okay? Okay, if there's any question, I have a couple of minutes left from this break. You can drop in the comment section, then I will answer before I go. At least I've been able to sort to those that have been asking for my contacts to be able to book an appointment. So you can do that now. Then after now, it's going to take like 72 hours for me to reply the messages. So it's not my fault. This is the time I have. That's why I said you should send a message now. You can get the link as soon as possible, all right? So that is that for now. I've not been able to shoot any video for the now, but what I can do for the now is to come on live whenever I have the opportunity to come live, whenever I have a little break at work, or whenever I'm less busy, I can actually pop online and take some coffee questions. Okay, I'm replying those that are sending me messages now, all right? So I can just send them the link. It's much easier. Here somebody asks, Dutton says, what is the cause of joint pain? Joint pain can be as a result of different causes. It can be as a result of inflammations of the joint lining, be inflammation of the joint lining. It could be as a result of sprain and strain. As people grow old, they tend to have this osteoarthritis. Osteoarthritis is also there. Then bleeding is also there. So if you are involved in the strenuous activities, you are likely going to have this joint pain, recurrent joint pain. So it's advisable for you to see your doctor. They can actually give you some painkillers to help relieve the pain at a particular moment. But I can't really pinpoint and tell you this is the major cause of joint pain. It has different causes depending on your environment, depending on what is happening. All right. Somebody asked, what causes pain in the lower abdomen during some sex position? What I advise when it comes to sexual intercourse is that do a position that is more convenient for you and is more comfortable for you. The cause of that lower abdominal pain might be as a result of where that pee is hitting, where your partner's pee is hitting, the movement, it might not be comfortable because generally you have organs around your body and things like that. And also lower abdominal pain, it could be like as a result of some infection, like on the lower around that pelvic area. If you're having that pelvic pain during it, it might be as a result of some infection that needs to be treated. It might be as a result of some other medical conditions like fibroid. I'm not saying it is for the women. You get, it's better for you to read. I made a video explaining the causes of pain during sex and the various types of pain. So I believe when you watch that video, it's going to give you an insight of what kind of pain you're experiencing and what is causing the kind of pain. So this live is not going to give you a detailed explanation to that. So just type causes, or I think you should type causes of pain during sex by Nurses Lecture Room. Then the video is going to pop up. Okay. Then God's plan say, hey Batmal, how do you all deal with death? I saw a dead body up close for the first time at the hospital. Scared the crap out of me. I think I'm going crazy. That's actually a difficult one because it's your first time seeing it. Yet, I think when it was my first time seeing it, actually when it was my first time, I had to prepare, like take care of a dead body and prepare the dead body to go for a mortuary. I can imagine how I felt. I couldn't really sleep for some days. But as time goes on, as a medical professional, you come to see life the way it is and you just get used to it automatically. So what I would advise you to do is to try as much as possible to take your mind off it. Do something interesting. Know that, put it in your mind that death is part of life. You get, people are going to die. See it as somebody that's sleeping. Like, do something interesting to help you take up your mind. Just put it at the back of mind that death is a normal process in a human, like it's normal. So don't see it as something big, just see it as something normal that is likely going to happen to everybody. So don't just take it personal and start thinking about it regularly or ponder about the dead body you saw. Okay, I know it's not going to be easy, especially when it's your first time, but try as much as possible to get over it and also stay around friends, be with friends, and I think you're going to be better. How to reduce bad breath. In terms of mouth odor, I can make a video. One of the causes of mouth odor is actually tongue. If you're not properly brushing your tongue very well, like the inside of the tongue, it's going to give that mouth odor. Then also, if you know after brushing morning and evening, you still experience mouth odor, it is very important for you to use a mouthwash regularly. So that gives you fresh breath from your mouth. So just after brushing, use a mouthwash. That gives you fresh breath. That's what I can advise in regards to that. Filani, what causes pain in the lower abdomen during sex? I've explained it. I've told you this question was asked before, and I advised the person that asked the question to actually watch a video on the causes of pain, because once you know the causes, it gives you an idea. There are different types of pain that occurs during sex. So when you watch the video, it tells you the different types, the causes, and how to deal with it. So I think you should watch that particular video. Is going to help you. Just type it by Nurses Lecture Room. Okay, then we have essays, how to give first aid. First aid is different. There are different types of first aid. It could be first aid when someone is bleeding, when someone is choking, when someone has a road traffic accident. It all depends on the type of first aid you are giving, because first aid is kind of like the first line of treatment you are giving to a patient at a particular scene that is happening. So different situations calls for different types of first aid. I can't say this is a first aid, like first aid that you can use for let's say first aid for bleeding is the same first aid for ROT, is the same first aid for choking. No. So depending on the type of first aid, that determines the type of first aid you're going to give. Depending on what is happening, that determines the type of first aid you are going to be given. Okay. So Milo said, can you help to get a scholarship? I have no idea about getting scholarship. I have no idea about scholarship education, so I can give you a talk on that. Simi Bukola said, good morning, Osmeri. Good morning, how are you doing? Trust you're doing great. Gosplan said, it's like I see that image flashing everywhere. I'm scared of dark and I'm 18. Everyone takes it silly. I sleep in the morning because I can't at night. It's been 2 months, but no better. Any suggestion? I don't really have a good suggestion for that. Trust me. Since it's been 2 months, personally, I would advise you to see, I don't know the country you are, I would advise you to see a psychologist. Is it a psychologist or a therapist? I think it's a psychotherapist or a therapist that can help you do away with it. It's more or less like, should I call it post-traumatic stress disorder? I don't really know the words to use. I'm not a psychologist to explain it better. So I can't really provide help in regards to that. And I wish you get better soon after that experience. What is the problem if a person is eating but is not going to the toilet for 4 days? That could be constipation. So in this particular point, I think you should see a doctor. You should get a laxative to help your stool come out easily. I think it's important you also increase your water intake, fruit intake, especially oranges like tangerine, clementine. So that is going to help with your with constipation. You could be having chronic constipation, you are eating very well, but yet you are not pooing. It's 4 days. That's something of concern. I would say try to eat more of fruit. And today that I'm telling you, try to eat more of fruit, try to increase your water intake, and also speak with your doctor if really concerned. Then best drug of choice for chicken pox. Do I have idea about chicken pox? I know about chicken pox, but I can't really tell you the best drug of choice. I'm sorry, except it's something I'll have to study. It's belong. I had an encounter with a patient with chicken pox, so I can't remember how chicken pox is being treated. But if I am able to do it, I can make a video for you when I want to make a video. I think that's the promise I can actually give you at this particular moment. All right. Someone said, how can I avoid piles and is there a permanent healing? In terms of piles, it's also known as hemorrhoid in medical term. One of the ways to avoid piles is to avoid constipation. Yes, one of the ways to avoid piles is to avoid, is to avoid anything constipation. Try as much as possible to be taking soft food. Try as much as possible to be taking more of fruits, more of vegetables, because those fruits and vegetables contains a lot of fiber, and these fibers help to soften the stool, so it makes you pass fecal matter easily. Try and do some lower your abdominal exercise, your pelvic exercise on that list. That's going to help with your muscles around that area to make pooing easily. So I think that's what I have in mind now about how to kind of avoid piles. I can share. Eat more of fruits, vegetables. So if you eat a lot of bread, you eat a lot of hard food that make it difficult to actually poo, I would advise you to reduce it and eat more food high in fiber, because food high in fiber are very good to prevent constipations. Okay, but I'm going to study more and see if I can get a lot about pie. Divine said, good morning, a student of AEA. Hello, Divine. I am an alumni. I would say I am an alumni of Ambusale University, Ekoma. It's nice seeing you, Divine, and I hope you are great. When is the right time to check whether we are pregnant or not? So the best time to actually check if you are pregnant or not is actually when you missed your period. That's one. Then also 14 days, at least 14 days after sexual intercourse, you can check if you are pregnant. You don't do a pregnancy test 7 days, 5 days after sex. No, it's supposed to be at least 14 days after sexual encounter. That is when you do a pregnancy test to actually confirm if you are pregnant or not. Very said, hello nurse, please, I'm not pregnant yet. My medicine is not coming for a month now. My gynae recommended Provera for 5 days and another medication, but still. So how long have you been taking this Provera? Did you do a scan? Did you do a test to find out what is actually wrong, Vera. So these are the things that needs to be asked. Yes, the doctor prescribed Provera. Why did the doctor prescribe Provera? What was the diagnosis? What did the doctor say you were having that made him prescribe Provera? And also, how long have you been taking the Provera that you feel the Provera is not bringing back your measles? Because I've seen some people who have this difficulty with their measles, but when they started their medications, it came back. But it doesn't just come back the day you start taking the medication. It might take time for your body to start. Okay, so Chinere John, okay, says, I'm happy to watch you live, Miss Mary. Thank you very much, Chinere. My nose, good afternoon. Amazing Grace TV. Thank you, it's nice having you. So my break is over, so I'm going to be going back. I'm going to come back again because I'll have another break. Then if I have the strength and capacity after taking my lunch, then I can do more life. Okay, bye and see you in my next. No, I don't think I have another break because I spent a lot of time. So all right, I'm going back now. You all take care of yourself. When I have another time, I'm gonna pop in and actually answer more questions because I'm gonna be off Sunday and Monday, but it's gonna be a busy day because tomorrow I'm gonna be preparing for my daughter's second year birthday party. So it's gonna be like going for shopping, getting the things needed for her birthday. Then on Monday properly is her birthday. Though it's gonna be a small birthday party with her and two of her friends alone. But it still requires a lot of preparation from my own perspective. I've not bought her gifts, so it's going to be a busy day tomorrow for me and also on Monday. Thank you all. It's nice seeing you all, and it's also very interesting taking all your questions on this live today. Bye and see you in my next live section.